I'm Meaghan. I'm a mother to 4 children, including 6-month-old identical twins. Finding out that I was having twins was the shock of a lifetime. I found out through an ultrasound that I had to check on the viability of my pregnancy. And when I went into the ultrasound, I was the one who actually noticed it before the technician said anything. I saw 2 perfect little sacs on the screen and I said, oh my goodness. So my first prenatal appointment was with the midwife practice that I had seen for my first 2 pregnancies, whom I absolutely loved. I saw a different midwife for this pregnancy, for this visit, and right then and there I realized that I was going to need to see a specialist for this pregnancy. So part of what happened at that first appointment made me realize that the type of pregnancy that I was going to have is something that not everybody is familiar with, and it carries with it risks that were a little bit frightening to me at that point. So that was when, after I had that first appointment, I decided that I needed to look for somebody who was really experienced in this type of pregnancy. And so that's when I did my search, and I found out that Brigham and Women's had a specific program for mono-di twins, and that's where I decided to have my care. The first visit with the high-risk doctor was humbling because it kind of laid out for me that the rest of the pregnancy was going to have be a lot of work. They told me that I had to really focus on a lot of protein in my diet. They told me that there was going to be a lot of ultrasounds and a lot of appointments, and that they would be very almost proactive if there was any sort of complication. They were going to be extra cautious with it. I went into the hospital for an induction when I was 37 weeks along. This was as far as the pregnancy would be allowed to progress on its own because of the mono-di twins. The risks increased beyond that point, I was told. The babies were very healthy. One of my sons, the smaller one, needed to stay overnight in the regular nursery to be under the lights for phototherapy, but other than that, there were no complications. I would tell other moms who are pregnant with twins that this pregnancy is very different than a single pregnancy. You definitely need to listen to your body, take it easy as much as you can, eat as much great food as you can, listen to your doctors, just take this pregnancy seriously and take good care of yourself. My babies are now 6 months old. They are healthy, they are chubby, they're playing, they're keeping me awake still, but they're doing great.